Pleasure to turn to Maayan Hoffman, the Jerusalem Post news editor, and Steve Waltz from the Sheba Medical Center, who will moderate together our next panel, How 2030 Medical Technology is Defeating Coronavirus in 2020.
So today we're here at a panel to focus on COVID-19, the crisis that has been hitting the entire world and of course here in Israel as well. We have with us in the Ulpan Dr. Eyal Zimlichman. He's the Chief Medical Officer and Chief Innovation Officer and the founder of the ARC at Sheba Medical Center at Tel HaShomer. And over here we have Dr. Galia Barkai, the head of the Telemedicine Hub at Sheba Medical Center. And with us also virtually, we're very honored to have Dr. Dorit Nitzan, the Director of Emergencies at the World Health Organization. Welcome, Dorit.
Welcome. Thank you very much.
Wonderful. Well, we're going to quickly just watch a video about the incredible work that is taking place at Sheba Medical Center before we get started.
Only those who know how the day starts, but not how it ends. Who tried, succeeded, then tried again. Those who worried. Those who did not give up. Those who felt the weight of responsibility on their shoulders. Only those who saw the end and realized it was only the beginning. Who brought new life into the world. Who've tasted victory. Those who constantly seek out the next discovery. Those who believed. Only those who slept 2 hours a night, who removed all social barriers, who kept their cool, those who dared, supported, protected, laughed, made others laugh, pioneered. Only those who broke new ground, who wake up every morning to carve a new path. Only they understand. Hope has no boundaries. Sheba Tel HaShomer, City of Health.
What an incredible film. 2 hours of sleep. I can imagine that that is what most of you have been getting during the course of this crisis. And Dr. Nitzan, I wanted to start with you at the World Health Organization. In your role at the World Health Organization, you deal with 53 member states, from what I understand, members of the European Union, the former Soviet republics, the Balkans, Turkey, and Israel. I wanted to get an understanding from you. Tell me about what it was like being at the World Health Organization at the start of this pandemic. Is this something that you, God forbid, ever predicted? And how did you handle it as it got started?
Thank you. Thank you for this question. Indeed, it has been a roller coaster. When we asked ourselves how we work, it seems like one long day. And actually, in the past, when when I was selected for the position here, we all thought that this is going to be one of the regions of the WHO regions that I'm going to have like easy life because, okay, we have the whole of Syria crisis from Turkey. We have a crisis in Ukraine. We had earthquakes in Albania, measles outbreak in many European countries, but nothing compared to the other regions in the world. And here, suddenly, out of China, it came to the European region. And that actually, we did not anticipate. We were prepared for in many of our countries, but not for such a magnitude, for nothing really for what we see now.
Wow, unbelievable. Now, I know that, the coronavirus crisis is not yet over, and there are individuals and countries that are suffering from post-traumatic stress disorder, from mental health challenges, from going through the COVID crisis. At WHO, what are you seeing, and what are some of the programs that are being put in place to tackle this challenge?
Yes, we weren't sure in the beginning, and we did not actually envision the whole scope of the needs of the people. And mental health became one of the prominent or predominant area that we needed to strengthen in our activities. We have at all ages. It's actually we see people, the elderly, those who were in solitude, the harm and the damage to livelihood, and many other issues that came up during the pandemic that are ongoing. We are going to see them for a long time. So we did work. We are working and incorporate into our actions and into our teams, psychiatrists, psychologists, and other social workers, of course, and others that can support communities, including volunteerism and other aspects. So we are trying to work along the age groups and with age group in different settings according to what people need. And this is something that we are going to probably need to invest in the future as well.
That's so fascinating. I want to thank you, Dorit, so much for joining us today. I know you need to get back to your other meetings and turn it over to Sheba to continue the conversation about mental health. Thank you so much.
Thank you. Thank you and good luck. Ciao.
So, Galia, Sheba was amongst the first hospitals in the world to develop a telemedicine program, even before the COVID-19 crisis began. How we used it before, during, and how will we use it after?
In mental health.
In mental health, right.
Yeah, so we've been promoting several programs of telemedicine for several years, and one of our major programs has to deal with psychiatric hospitalization and long-term outpatient monitoring of patients with psychiatric disorders. We found that it helped the people. They didn't need to come to the hospital during that period. It helped us a lot to protect them and protect the staff during the corona period. What we also did during this period is to change our outpatient clinics from frontal visits to video visits. So one of the major things is that all the psychiatric wards moved to video visit, and it was really one of our biggest successes, I think, during this period. Also, all the hospitalized patients with COVID-19, we allowed them services of social health, psychiatric health, many of them through telemedicine, through video, because we understood the big need during that period. People were in isolation, they didn't have their families, they were really sick, they didn't know what's going on, we didn't know the disease, and they were separated from the staff and from their family members. So we allowed all of our patients psychiatric help, psychological help, and social work.
Okay. Amazing. And you know, it's interesting because Eyal, you actually founded the Sheba Arc for Innovation, as we mentioned. And my assumption is that when this all got started, we weren't predicting that we were going to need new treatments, potentially a vaccine, in order to deal with a novel pandemic. Tell me how you managed to pull everybody together and get them focused on developing innovation around coronavirus.
It's a great question. You know, at Sheba Medical Center, we have a very strong innovation ecosystem. We basically have built ARC in the past 4 years to really be able to challenge and solve some of the biggest challenges we have in the healthcare world. We never thought we're going to have to focus as much in the pandemic issues, of course. But when Corona started, we made a decision. We're putting everything else on hold, and we're focusing 100% of our efforts in innovation only to find solutions for COVID-19. Not just vaccines and medications and therapies, but also telemedicine solutions, also new ventilation technology that we might be needing, also mobile technology. So many different types of technologies that are helping us today and actually are being used around the world that came from Sheba.
Amazing.
And the telemedicine program was one specific aspect of the challenge ahead for Sheba during the course of COVID-19. 11 technologies were used over the course of a period of time, over several months. So what has happened going forward? How did our telemedicine programs at Sheba, how did they change the way we are going to treat patients in medicine in 2025? Or have we already reached 2025 based on what had happened during the COVID-19 pandemic?
So some of the things we're looking to do in telemedicine, and we had this vision already laid out before COVID, we have a plan for 2030 and how healthcare needs to look like by that time. And we know medicine has to move to the home. We know hospitalizations will need to happen, most of them at the home. People will not have to leave their home to be hospitalized. This will change by 2030. We think about 70% of current hospitalizations will be able to be done at the home level. So that's one thing that we've started seeing moving in COVID. The other thing we've started seeing is how our staff is embracing now telemedicine technology that was much difficult to do before. When we are faced with no alternatives, when patients are at their home and cannot come to the hospital, it's either we don't take care of them or we do this through video and we examine them through technology that allows us to examine patients from afar. When many doctors were skeptic of that type of technology before, they've now are embracing it in many ways, and that will, of course, help us reach that vision we have for the future.
Well, before we turn away from that, can you just give us one or two examples of the incredible technologies that were developed in the last 3 months at Sheba?
So for example, when we talk about ventilation, one of the issues is we all were afraid we won't have enough ventilators. Of course, this was a world issue. In some countries it actually happened, like Italy, like in some areas in China, like in some areas in the US. So what we've done together with one of the secret units in the army is we've built a ventilator, which I think now is probably one of the most advanced solutions that are replacing ventilators. This was done in a record time of about a month, from inception of the idea to creating the product, to filing for the patent and starting to mass market it around. We're actually looking to sell it now to other countries in need. We have about 100 of them already lying in our warehouses at Sheba, waiting for a crisis that we hope will never come.
Speaking of a crisis that we hope will never come, we are looking like we're getting toward a second peak or a second wave, depending on what terminology we want to use. On average, we're seeing 400 or 500 new patients diagnosed per day, and the country is getting a little bit nervous. Tell me, is it here? What are we going to do?
So it's definitely here. It's not going anywhere. And we're really seeing these 2 last weeks a rise in patients diagnosed. It has to do a little bit with different ways that we're checking people now. We're also diagnosing people that are not symptomatic. But slowly, we're seeing more patients in the hospital, more patients in the ICU. And we think we're in the second wave. There's no other way to say it.
And I understand that recently you just opened up your underground unit again. Tell me a little bit about that unit. How many patients do you have there, and how many can it accommodate?
So it can accommodate, in the way it's open now, about 40 patients, and it can grow even bigger. Right now we have 5 or 6 patients there ventilated, and we hope we don't have more, but we have another internal ward, a corona internal ward, which is quite full with corona patients. And as opposed to the beginning where we had everyone coming in and some even not so severely affected patients, now the patients that are hospitalized are at least intermediate or severely affected. And we're worried about where we're going to.
So you think that younger age is not really sticking? We've sort of seen that as this new peak has come, that we've had a younger age patient. We were getting infected in schools. We were getting maybe their parents infected, but that age is going up.
So they're younger than in the beginning, but we're seeing now that the age is getting up. Yeah, it's increasing. So we're worried about these trends.
Ayal, the greatest challenge ahead, we're in a second wave now that we didn't anticipate, which means we're probably going to get a third wave during the winter months. How is Sheba gearing up for what we would call the double whammy? The flu, which is hard to diagnose, versus COVID-19. How are we gearing up? How will we deal with it? And from another point of view, that we're using these summer months to do a lot of research on a lot of the potential treatments, where is the hope, if there is any?
Well, that's a difficult question. First of all, just to let you know, we were ready for a catastrophe in the first wave. We were expecting many, many more patients than we actually received. We built capacity of more than 100 ICU beds, of more than 100 to 200 general beds. We only used a fraction of that, of course, as you know. But we are pretty much prepared for a larger wave that will maybe will come in the winter, as you're saying. We also know much more about the disease right now. It's not that we have a cure, but we know much more how to ventilate or try to prevent ventilation. We know what medications will help us. So we're much better prepared, and with time we're learning more and more about this disease. So I think by the third wave, maybe this next winter, we'll know much more, even if we don't have the actual therapy. And the hope lies, I think, in the vaccine. We're seeing now dozens and dozens of companies that have a product that they're working towards. I think the first one is probably expected before the end of the year. The main question, once we do have a vaccine, is how quickly can we get the population on the vaccine? Because we'll need to manufacture enough vaccines and then obviously use that for the entire population. So that's going to be a major challenge. It might take up to a year from when we have a vaccine out to getting everybody vaccinated. So that's going to be another challenge.
I would like to be a bit skeptical because we don't know that the vaccine will work. It's the Moderna vaccine, which is the first one to be ready, we think, maybe in January, February. It's an RNA vaccine. We don't have RNA vaccines yet. So we hope it's going to be effective. And as Eyal said, we hope we can produce quickly to many people. So and definitely during this winter, we won't have it. When the flu period will be in its its high wave, we won't have the vaccine yet. So I'm a bit worried. But we're prepared. We're prepared with Sheba.
Let's talk a little bit about that. So Sheba is prepared, but we have other hospitals throughout the country, and we have many potential patients throughout the country. How prepared is the state of Israel for handling the flu and the coronavirus together, even if the patients that come to Sheba can be treated?
So I think we have enough beds and equipment. The problem is with the staffing. We don't have enough doctors, and every year the internal wards are crowded, overcrowded, and that's one of the problems. But I think the hospitals are ready, and we'll be handling it. We have some improvements to do in the state. The epidemiological investigation should be quicker. The Ministry of Health should invest in that. The results of the corona tests should be a bit quicker. But I think things are improving in last week.
So I think that based on what we've been hearing and reading about in the news all the time, and it's kind of disturbing, and I'm sure both of you are paying attention to the news as well, and you don't make the news yourself. But there are a lot of people out there who say that the COVID-19 virus, come on, it's no big deal, it's just a mild flu. Both of you have been exposed on a day-to-day basis to this virus, from young people as young as 9 to all the way up to people in the 80s. I would like to hear from both of you your experiences in dealing with this, and explain to people that this is not a joke.
Well, I'll say first of all that you're right, it's not a joke. We're lucky enough that only a fraction of patients that actually are infected by the virus develop a severe disease. But those that do develop a severe disease develop a very, very severe disease. And we've seen those in our hospital. It's a very prolonged hospitalization, and then a very prolonged time of rehabilitation after that. So it's somewhat like a Russian roulette. And if you'd like to play Russian roulette, it's fine. You should probably think this virus is nothing. But for those of us that don't like to play Russian roulette, I think we should be very worried about it.
And I think what we also see is that it's really unexpected, and we see patients after recovering from corona having other complications, and some of them, even the youngest people, it takes time to recover. They continue for weeks and weeks to suffer from extreme fatigue, do not recover quickly. They have neurological complications. So it's not as easy as it looks, and every day in corona we learn something new about the disease that we didn't know before.
Fascinating. I believe there was just a study that came out recently from Shaare Zedek Medical Center that mentioned that 50% of patients that they were seeing actually had some long-term effects from the coronavirus.
We see the same.
It's amazing. And talk a little bit more about the children, because I also understand that as we're seeing more research and more months go by from when children were infected with the disease, we tend to think of corona as an older person's disease because they become more acute more quickly. But we're seeing some long-term effects to children potentially that could be quite frightening. Can one of you talk about that?
Yeah.
The pediatrician.
The pediatrician. So indeed, most of the children are less severely affected. So many of them are asymptomatic or mildly symptomatic. But we've seen some rare complication. One of them is the Kawasaki-like syndrome, which occurred worldwide. We've seen several cases in Israel as well. So Kawasaki syndrome is an inflammatory syndrome that occurs after we recover from the disease. And it causes high fever and several other complications, including cardiac complications and sometimes even shock. And many of these patients need to be in the ICU, needed to receive medications to keep their blood pressures. But in Israel, most of them, all of them recovered. We have treatment for that, but we have to have a high index of suspicion to diagnose it. But it's not without complications, yes.
It's very frightening, and we know that it's about 10 million patients, I feel like, around the world that we just recently passed, and we don't see that number going down. So how long are we in this? We talk about second waves, third waves. Is this for life? Is this for another year?
So, there are two scenarios. One is that a vaccine will come around that will be effective. I'm more optimistic about that because there are many, many, many efforts. As I said, dozens and dozens of efforts trying to target different areas. And if one will fail, maybe another will succeed. So I think we have a good shot at that one. And the second, which is not so optimistic, which we get the herd immunity. At some point there will be a herd immunity. And then, at that point, it won't be a factor anymore, just like many of the other viral diseases that have gone out of this world because of herd immunity. So if the vaccine comes through, we're likely to see between a year to maybe a year and a half from now that this will still be a factor. If it doesn't, then maybe 2 or 3 years before we get to herd immunity.
And can you just, for our audience, define herd immunity? Because I think we hear that term a lot, but not everybody
Sure.
knows what it means.
So we don't have to have everybody in the public vaccinated or immune to the virus. We need to have a fraction of them. We need to reach that percentage. Once we reach that percentage, the virus can no longer become a threat, and slowly it will start diminishing in size in terms of the population affected until it goes away completely.
Amazing. And let's just bring it back to Sheba just for another moment, if you don't mind. I'm also interested in terms of the international work that you've been doing. We talked about the ARC, and I know there's been some international collaboration there, as well as on other fronts, helping worldwide with other countries to be able to tackle the coronavirus, as at least we looked that we successfully did in that first wave here in Israel. Can one of you speak to that?
Well, I'll say one story. We've been teaching many countries. We have webinars. Steve will say.
Almost every day.
Huge number of those.
Almost every day.
Every day there's a webinar somewhere in the world with Sheba.
Right, and we've also built our smart room where we have all the COVID-related technology being implemented in one smart room, which is a simulated room, where we could bring in mannequins or simulated patients to study. And we've used that to also do a webinar where we had more than 1,000 people log on to see what we're doing. So we're teaching the world constantly. But even we reached out to help in the US, and we've did some work with the New York Department of Health. We've actually helped them with some of the issues they had around innovation. They needed some solutions, and we did offer help and did help them to some of those problems. So it's always something that we're doing on a day-to-day basis.
And it is fascinating to watch other countries. I sat in on a session with psychiatrists from Mexico who were basically clueless, and they hung on every word that we told them.
Yesterday I appeared in a seminar in Latin America.
Right,
I think
and so
6,000 people.
6,000 people. What are the things that they were asking you? What are the things that they are focusing on? Because it appears that some of the countries really, especially third world countries, have no clue as to how to deal with this.
So they ask how to implement innovation really quickly, how to implement new technologies quickly when you don't have time to test them and to train everyone, and how we managed to do this, how we treated inpatients with telemedicine, which was a new concept, how we managed to treat our other patients that and save them the need to come to the hospital. They were asking all these questions. This is from in person. They were also asking the other specialists about treatment, PPE, and all the other issues around treating patients with COVID-19.
Okay.
Amazing. And as we're going to get closer to the end of the interview, I want to make sure we have a chance to reflect backwards to the time that Sheba, the first hospital to open up and to take coronavirus patients, took in the Israelis who were on that Diamond Princess cruise ship up until today. What is something that you have learned that you're going to bring with you and that you feel like the rest of the world needs to hear?
Well, I'll of course mention innovation. I think when we started this, it wasn't clear what role innovation would play. We even had some thoughts that maybe our innovation team needs to go on to working from their home or go on leave of absence. But we very quickly understood that innovation is going to be critical because we're tackling something that we have no clue about. This is a new disease. We're learning every day. And innovation is going to play a critical role. And so our innovation team was really very, very busy. We've came up with more than 40 inventions during the time of about 2.5 months. It was amazing the amount of work. People weren't sleeping and coming up with all of these great ideas. And now we're sending much of that into the world and teaching others. So I think from my perspective, it's the role of innovation during times of crisis. And we don't always get an opportunity to use it. Sometimes I wish we wouldn't. Obviously, we'd like to have quieter times. But when it does happen, it's good to know that we can count on it.
The Data Corona Challenge would be the perfect example of how we use this time in a positive manner in working with some of the biggest companies in the world like Intel. Can you tell people about how Intel will be working with Sheba going forward on a technology that could save a lot of lives?
So from really day one, we've made a decision that we're going to upload all of the data on the corona patients. Of course, they're identified, so nobody knows about the identity of the patients. We're going to upload that to the cloud and have data groups in Israel who know how to deal with big data start working on it to come up with insights. Again, we want to know as much as we can about this disease. And so we've had about 40 groups that worked on the data. We then had a competition, which was about 2 weeks ago. 6 finalists came up. They presented their solutions. We had a group of about 20 judges on the panel, 10 from Sheba, 10 international. And Intel came into as first place. And people were asking me, so what's the reward? What's the prize for the first? Is it money? Are people going to get money? I said, we don't really need to pay Intel. I think they're doing fine. But what we are going to offer them is the winner is going to implement their solution. And this was an artificial intelligence solution to predict which patients are about to deteriorate. We can implement that at Sheba so they can actually save patients. So at the end of the day, the winner gets to save patients. And that was everything that this was all about.
Because in the end of the day, it's always about saving lives when you're talking about a hospital or medical care. And that's what makes everybody there, you know, an angel and a warrior and everything in between. Galia, final sentiments. We're going to have to pull this together. So tell me, what is the message that you want to share with our listeners?
So I think that really, as you said before, this crisis was a great opportunity to take away many obstacles and to promote quickly innovation. And I think what we'll see next won't be the same. I think many obstacles went down, and people will now embrace new technologies that will actually reinforce us as physicians, as nurses, as medical staff. The technologies will reinforce us to reach many more people and to allow many people to receive greatest medical care.
Yes,
that's fabulous.
Going forward, Ayel touched upon the dozens of companies that were involved. As of now, Sheba is engaged in 184 different types of projects that revolve around Corona. So going forward, Sheba has a lot of work to do, and based on what we think is going to happen now and in the coming months, that number could increase, and the challenge ahead is something that Sheba doesn't exactly shy away from.
I think it's wonderful, and I hope that you have much success in that. Thank you so much for being with us today, Eyal and Galia, and of course to Dorit Nitzan, who joined us from the World Health Organization. We hope that the silver linings of being able to tear down some of the barriers, innovation, is what we'll remember when we come out of the COVID-19 crisis. Thank you so much.